My name is Sarah Bourns and I'm farming here in Lisbeg Dairies with my husband Chris in County Galway. We have a crossbred herd, a spring calving system, and we have just over 900 cows. We were having issues with pneumonia in young calves from 2 to 6 weeks of age. We would see they would go off their milk feeds, they would run a temperature, they would start the coughing, and it was spreading from pen to pen. And it was very, very time consuming to treat, along with the lack of thrive they were doing during that period. We decided to start using Bovipast here on the farm after having a discussion with our vet, Aideen Rigney from Kyle Boher Vets. She's based in Kilcormac, and she advised us to use the Bovipast RSP. Since we started using Bovipast on the farm, we have seen a complete reduction in pneumonia cases. They're actually really isolated cases now. The time we spent, treating calves and everything, so we've seen it from a labour point of view, a thrive point of view, and it's cost effective. When the cows calf here on the farm, the calves receive 4 litres of colostrum straight away, and then they are transported up here to our calf yard. They get the intranasal vaccine from birth, and it fits in really well and nicely with our routine. So I tag the calves and I give them their vaccine, and that's it. So in relation to the Bovipast RSP, dose 1 is at 6 weeks of age and dose 2 is at 10 weeks of age before they go out to grass. I would definitely recommend using Bovipast RSP to any farmer that would be considering it. It serves as a great peace of mind for calves going out. They're so valuable and you work so hard to get them on the ground, to get them reared. It's just that assurance that's needed on farm.
We were finding when the calves were 3 to 4 weeks old, they were getting pneumonia. So we wanted to start a vaccination protocol. We decided to go in with Bovillus intranasal at 1 day old, and then with the Bovipast at 6 weeks, and then again at 10 weeks. And we found this good because the Bovipast covered both the viral and the bacterial aspect of pneumonia. We found with a good nutrition and environment, topped up with a good vaccination protocol, it worked well on the farm, and we now have no antibiotic use with the calves currently. I would recommend Bovipast. We have found it has worked very well on this farm and we're very happy with the results.
Bovillus Bovipast RSP is an inactivated vaccine for cattle to reduce infection associated with PI3 and to reduce infection and clinical signs associated with RSV and Mannheimia hemolytica serotypes A1 and A6. The vaccine can be administered to calves from approximately 2 weeks of age. A primary course consists of 2 doses administered 4 weeks apart. Each dose is 5 ml, administered subcutaneously or under the skin into the side of the neck. A single booster dose should be administered 2 weeks prior to a known risk period, such as pre-housing. Vaccinate healthy animals only. Good hygiene during vaccine handling and administration is important, and also shake the vaccine well before use. The shelf life of the vaccine after first opening is 10 hours. The vaccine should be stored in a refrigerator between 2 and 8 degrees Celsius. Onset of immunity is 2 weeks after completion of the primary vaccination course. This vaccine is available in a 10-dose pack. Bovillus Bovipast RSP can be administered on the same day as Bovillus IBR marker live, not mixed, from 3 weeks of age. For further information, contact your own veterinary practitioner or visit bovillus.ie.